This is Rick with Valent BioSciences Public Health Team, and we're here today with Tracey McNamara. Dr. McNamara was the lead pathologist at the Bronx Zoo in 1999 and one of the key members of the team that helped to identify West Nile virus in an outbreak that began there. Thanks for being with us today, Dr. McNamara.
Thanks for contacting me.
Very, very good. Well, you know, one of the things I found most interesting about your role in the West Nile virus outbreak was how you seemed to be the one that was building the bridges between organizations and people, so to speak. And could you kind of walk us through what was going through your mind as you started to navigate that?
Well, when I first started investigating the dead crows in New York City, and then the encephalitis outbreak spread into our zoo collection, that happened at the same time as New York City announced that people were dying of an unusual encephalitis. And I immediately, a red flag went up in my mind because I thought the temporal and spatial relationships between the two outbreaks were too striking to ignore. And, working in the zoo field, which is kind of a frontier of veterinary medicine, I was always on the outlook for something new and unexpected, and because I was working on species about which we knew very little. And so it wasn't at all surprising that I, aggressively went after a diagnosis, because that was my job. And when I thought it crossed species lines, I immediately reached out to public health as well as the USDA, and was very surprised when I was rebuffed initially by the CDC, because that had never been my experience. Working in the zoo where I dealt with so many zoonotic agents, I had always reached out to particular experts in any given field, and because people love working with zoo stuff, I had never had any problem engaging other scientists. So it came as a real surprise that the CDC was not interested in testing our samples, but that ultimately led me to reaching out to the U.S. Army.
I was also, and for me, I'm kind of a lay scientist, and I was kind of taken aback by the notion that a virus that was affecting animals wouldn't be of interest to the CDC. I mean, it seems, we're mammals, right? So have things changed since then as a result of what happened? I mean, do you know, if you were to call them today, for example, would their attitude be different, do you think?
Oh, I think so. Things have changed a lot since 1999. But in terms of mission statements, we still have a lot of orphan species that do not fall under any national surveillance programs, specifically dogs and cats, urban wildlife. Nobody is in charge of those. Nobody cares about them. And I find it very alarming, because those animals are the ones most likely to serve as urban biosentinels if there were an intentional release of a biological weapon, or, just as with West Nile virus, an emerging infectious disease that hits multiple species. So it just means to me that because the USDA will only test cows, because the CDC's mandate is only to work on humans, we still have some work to do on the policy level to make sure that we don't have these gaps in our biosurveillance capabilities.
Okay, well, I'm sure that we'll come back to that, but you were beginning to tell us about the Army, which I was a big hooray on my end when I read that the Army kind of stepped up. So why do you think that was, or can you just kind of relay that to us? How did that go down?
Sure. Well, as a veterinary pathologist, people always said, what made you think of the Army? Well, I worked with them, every single Wednesday when I was a resident. I took part in this glass slide conference that's used to train people in veterinary pathology. It's sort of the gold standard. And I also had read Richard Preston's book on the Ebola Reston outbreak that took place, and knew of all the work that USAMRIID had done. And by the time 3 weeks had gone by, had continued to refuse to test my samples, and by that time the USDA had proven it was indeed a flavivirus, and which strengthened the link between the two outbreaks, and that it was a BL3 containment agent. So I knew I needed a place with the proper biocontainment, with every reagent known to every dangerous virus known to man, and what I was hoping would be a real can-do attitude. And literally, I woke up at 2 in the morning, a light bulb went off, and I was like, I'll call the Army. And that's what I did. And I spoke with a brilliant man, Dr. Jonathan Smith, who was the head of the virology department, and he was extremely concerned about my health and the health of everyone in the hospital who'd been working on these birds. He thought it was going to be Eastern equine encephalitis, and I was like, no, I don't think so, because I had built-in sentinels for Eastern equine encephalitis. We had a healthy flock of emus, and the fact that they are exquisitely sensitive to Eastern equine encephalitis was in the veterinary literature, in the journal Veterinary Pathology, and so I knew if it had been Eastern, they should have been dying. Just as the chickens would have served as sentinels for either Newcastle's disease or avian influenza. So that's what led me to reach out to the Army, and all I had to say was, it's something new, and I think it's killing, both birds and people in New York City. And they jumped right on it.
So
oh, wait, let me add one more thing, though. The funny thing was, when I was speaking with Dr. Smith, I said, well, what I really need is a veterinary pathologist that I need to speak to, because we're going to have to create an immunohistochemical stain to stain all of the tissues of all of these birds to see where the virus goes, what its tissue tropism is, so we can figure out what this virus is doing. And he said, well, I can put you in touch with Dr. Keith Steele. I went, Keith Steele? He's like, well, yes, do you know him? I was like, oh, his wife, Laura Richmond, did a residency at the National Zoo. She did an externship with me at the Bronx Zoo, and I was at their wedding. Of course he'll look at my slides. And so just through, basic serendipity, I was able to get my, tissues and slides into Fort Detrick because I knew people.
That's great, Tracy. So you could tell right away, okay, now things are starting to fall into place here.
Yes, the 48 hours working with Fort Detrick was the most exciting of my career. And we agreed to share all of our findings with CDC Fort Collins as they came out. And that's how the two labs were working together. And I think it made a big difference when all of a sudden Fort Collins got a call from Fort Detrick saying, guess what? She's not crazy. It isn't St. Louis. It is a flavivirus, and it's something else. It's something new, so that put a lot of credence behind my claims, and that's from that point on, everything went very quickly.
Now, there was another researcher that was concurrently doing some studies in California. Isn't that true?
Ian Lipkin. And the funny thing about that is, around 2 weeks before the so-called encephalitis project meeting, which is held every 2 years, it's hosted by the CDC, because 75% of encephalitis cases are never diagnosed as to cause. And I had called the New York State Department of Health and had spoken with someone who's now retired, a Dr. Leo Grady, and was telling him my sob story about no one being willing to test my samples and that it was a flavivirus, and I was worried about biosecurity, and he was very, very helpful to me. And but unbeknownst to me, he attended that encephalitis meeting and met Ian Lipkin. And I guess they got to talking because Dr. Grady knew all about, the bird die-off and me screaming about there being a connection between the birds and the current outbreak in people. And at that meeting, the New York City Department of Health decided to give Dr. Lipkin samples of brain from one of the human fatalities. And he was able to do deep sequencing. in his California lab. And this was all going on at the same time as we were doing our animal studies, and the synchronicity of this whole thing was just amazing. But it's kind of funny, one
yeah,
phone
that is
call
really
leads to another relationship that leads to another discovery. So yeah, it was really cool.
Well, Doctor, what changes have you seen then in policy or process since the outbreak?
Well, West Nile virus, which, as I told the people at Fort Detrick, if this was, a Broadway show, it would have closed on the first night because, it was, an utter failure of agencies to respond to an emerging zoonotic threat. And if it had been a biological warfare event, 3 weeks would have been a big deal. And I think it made everyone wake up to the threats that we're now facing. And I think there is now much greater cooperation between public health entities and the veterinary community. And in fact, the West Nile virus outbreak really was the genesis of what is called the One Health movement, which is really gaining traction, so much so that 7 senators, people like Al Franken and Dianne Feinstein actually submitted a letter to the White House supporting the One Health movement, and Al Franken has he put forward a National One Health Act of 2016 bill to understand, prevent, and respond to animal disease outbreaks. So it's made it to the White House, it's made it to the Senate. At least people who are in a position to change things are aware of the issues, and they're trying to do something about it. From a monetary point of view, the USAID agency funded the Predict and Prevent project, which is something that pulls together public health as well as universities and private conservation organizations on a $200 million program that is dedicated to detecting the next emerging infectious disease. Most of their work has been done in Asia and Africa because that is where, historically the emerging infectious diseases have come from. Zika took everybody by surprise because I don't think we've been putting a lot of money into South America, and, insto presto, we have a new, public health threat. But there's another program that's going to be funded at $180 million through the Defense Threat Reduction Agency of the Department of Defense, and that has a large One Health component to it. So, people are more aware of the need to work across species boundaries, and there's actually been some funding, most of it outside of the United States, but at least, it's a move in the right direction.
Excellent. Well, you mentioned Zika virus, so what similarities do you see, Tracey, as you look back and between West Nile and what's happening with Zika today?
Well, once again, that we were taken by surprise. It is sort of ironic that we've spent hundreds of millions of dollars looking for the next emerging infectious disease, but, we were looking in the wrong place. And I think, they always say cockroaches are going to inherit the earth. I don't believe that for a minute. It's going to be the mosquito. And with global warming, it really shouldn't come as a surprise that it's another mosquito-borne disease that's causing a problem. And just as during West Nile virus, I think we're still caught with our pants down in terms of our pest control programs and their funding. We're not very good at preventing disease outbreaks. We're a very reactive nation, and we respond to outbreaks when they happen, but they don't like to fund preventive programs, which would make much more sense in the long run, but it's hard to, gain funding for those programs, and that's why we're still very unprepared for Zika.
That's interesting, Tracy. We did some research a few years ago. We talked to mosquito abatement directors, and one of their biggest challenges is that when they are successful, nothing happens. And so
right.
you go to the municipalities and you stress the need for more funding for these programs, and
right.
people are like, what mosquito problem? We don't have a mosquito problem. Well,
right.
that's because we're doing such a good job. So it is kind of counterintuitive. Well, Tracy, what about personally? I mean, what did you take away from your involvement? What's the impact been for you?
Oh, West Nile was definitely the most exciting and gratifying work of my career. It was a complete validation of my veterinary training and education and the veterinary perspective in today's world of emerging infectious diseases. It was a validation of the role of pathology in detecting emerging infectious diseases, one that has been underplayed and underfunded and needs to be explored on a much greater scale. On a personal level, unfortunately, West Nile virus ended my career as a zoo pathologist due to internal politics and jealousy, and that was a very bitter pill to swallow. But I've moved on and I'm now extremely happy in my new career and my involvement in biosurveillance activities. So it all worked out for the best. I wouldn't have done anything differently. And, I still don't regret for a minute my involvement in bringing to light the connection between the bird and the human outbreaks and enforcing relationships between the Army and the CDC.
Awesome. How about when you speak, Tracy? I mean, what are the takeaways that you want to leave with your audience when you speak about what happened?
Well, I think the one thing no one talks about, and that really concerns me, is that wildlife disease surveillance in the United States is still the weakest link in our chain of biosurveillance capabilities. People don't realize that state wildlife agencies, and they're the ones that have, domain over all wildlife except for federal wildlife, federally protected species, and these state wildlife agencies rely on the sale of fishing licenses and hunting permits for their budgets. It's pathetic. I mean, look at the budget of the CDC, look at the budget of the USDA, and then look at the budget of the National Wildlife Health Center, the one lab in the country that has diagnostic capabilities, and it was like $500,000. Well, what do you expect? Of course we're not going to be able to stay on top of things because we do not fund wildlife at the same level as we do either human medicine or agricultural species that are worth money. But it becomes everyone's problem if it's a wildlife sentinel that gets missed by 3 months, and that's what happened with West Nile virus. The truth of the matter is, if those crows that were dying in New York City at the beginning of June had gone to a bona fide diagnostic laboratory that used microscopes, that could do immunohistochemistry, that could do virus isolation, we needn't have had people dying in mid-August. We completely dropped the ball on picking up West Nile virus because of the disparities between the diagnostic capacity of human health, veterinary health, and wildlife health. There's simply no comparison, and that's the one thing that has not changed. There's been no increase in funding to state wildlife agencies. People don't even want to talk about it. And so that keeps me up at night, and I don't know what to do to see how, to force that change. But, I'll keep talking. I did get a phone call this year from a guy who said he was with the ODNI, and would I be willing to speak with him? I was like, well, of course, tell me what the ODNI is. I'd be happy to talk to you. He was calling from the Office of the Director of National Intelligence, and they wanted my opinion on our vulnerability regarding wildlife. And, that to me was a wonderful phone call because it meant that people at the highest level are at least looking at it, and that's the beginning of change. I tell the defense people, and they get this, I talk about a species gap, and if it's a free-ranging wild animal, because it has no owner or no monetary value, no one's in charge, no one cares, and no one's going to pay for it. But it makes a difference if that first diagnosis could have prevented human deaths down the road.
Well, Tracey, is there anything else I didn't cover that you would like to add?
I would just, my key message when I talk to people is to stand your ground. If you think you have something that needs to be investigated, don't take no for an answer, and do the right thing no matter what the cost. And there is a quote from George Ludwig, Dr. George Ludwig at USAMRIID, that I want in my obituary. And he said that I served a central role as a unifying force, molding and sometimes forcing interrelationships between local and federal agencies and private enterprises, enabling progress towards a common goal of monitoring a newly emerging disease in the United States. And that makes me very proud. I guess it's a good thing I was born a New Yorker, and I don't take no for an answer.
Well, Doctor, you've been very gracious today. I really appreciate your time. I look forward to hopefully meeting you one day as well. And you've been, again, very gracious, and I appreciate it, and appreciate everything that you've done also.
Oh, well, thank you very much.
You,
I hope people, take the message to heart, and if there's something we can do to somehow strengthen the wildlife sector, it'll be in everyone's best interest.